So chronic pain, as we all know, it's one of the pain lasting more than 3 months. It's common in elderly and age-related changes because of the age-related changes, and it affects their physical, mental, and social well-being. Pain is also defined as unpleasant sensory or emotional experience. It is linked with actual or potential tissue damage. And we tell it is as chronic pain when it is lasting more than 3 months. And it is classified as nociceptive. It is can be neuropathic or nociplastic, depending on the origin of the pain. One of the most common causes in elderly is osteoarthritis, low back pain, or spondylitis. Neuropathic pain, maybe because of diabetic neuropathy or because of slip disc, like that. It may be because of post-surgical pain or osteoporosis and fracture pain. What happens is because of this pain, patients, because elderly, they'll have limited mobility, poor sleep, depression and anxiety, and reduced independence. So all this causes a lot of depression and anxiety, and it becomes a vicious cycle because of the pain. Unless we treat pain, we can't come out of this vicious cycle. So one of the main modalities is first we have to assess the pain. How to assess the pain? Pain is very subjective for each patient, and we have to. There are different scoring systems for assessing the pain. One is visual analog scale. We by that we can assess from 1 to 10 scoring of the pain. First, we need to take a detailed history, physical examination, and if any imaging is required, X-ray or MRI or CT, and any blood test is required, we have to get that done and to assess the pain. So it may be primarily chronic pain, maybe because of a health condition or often nasoplastic. It may be because of some cancer related or cancer symptoms, or maybe it may be because of some trauma, post-traumatic pain. And it may be because of some neuropathic element involved, whereas nerve is involved because of the compression of the nerves. And some orofacial dental type of pain may be there. Or sometimes it may be post-herpetic neuralgia pain, herpes or diabetes, or any other condition leading on to the pain. Or sometimes pain may be arising from internal organs, abdomen and pelvis. Or it may be just muscle pain, bone and joint or muscle pains, which is more common in the elderly. So how do we treat this pain? We have to approach multimodal approach for this pain. What is multimodal approach? One is medications, lifestyle modifications, rehabilitation therapies. We do certain uh, exercises, programs, yoga therapy. All these help in the in pain mitigation of the pain. And after that, if it still doesn't subside with medications and these rehabilitation or restorative programs, then we go for interventional procedures where we give in the nerve blocks, injections to the nerves, which causes this pain. And even some cognitive behavioral therapy and counseling programs in pain management have also been found to be very helpful. Acupuncture, mindfulness, and other holistic approaches also have been found to be very helpful in treating chronic pain. First is non-pharmacological approaches, that is gentle exercises, yoga, physiotherapy, and uh, enriching the diet with calcium and vitamin D, relaxation techniques using mindfulness, yoga, pranayama, and medications. Social engagement, because most of these patients will be isolated, and because of this, it becomes a depression, and again, it causes a vicious cycle of increased pain. So how do we treat the pain with medications? First is some simple NSAIDs, then some stronger medications like opioids, and then more in targeted approaches we take. First, we start with simple medications like diclofenac. After that, depending on the type of pain, we can increase with pregabalin or gabapentinoids. And so there are certain conditions like fibromyalgia and all, which are very hard to treat because of their various presentations. Because diffuse musculoskeletal pain, depression, fatigue, sleep disturbances, and all these cause, it is one of the very hard to treat pain, that is fibromyalgia. And then we add on some antidepressants to overcome this type of depression along with the pain. There are few anesthetic medications like ketamine, which are helpful in some certain types of refractory chronic pain. And it has been found that yoga acupuncture has been very effective in along with this little pharmacological agent of tablets for treating pain, along with some behavioral therapies. So one of the things which I am trained is interventional pain therapies in chronic pain, where we do nerve blocks, where certain particular treat therapy, like in chronic back pain, we do certain injections. Like if the patient is having disc collapse, we can do particularly nerve block to that region. We call it epidural steroid injections, and we do some radiofrequency ablation neurotomy, where we particularly burn certain nerves supplying the particular joints, like the basic nerve ablation we call radiofrequency ablation. With this, the patient will have some 6 months to 1 year of pain-free. That is one of the procedures we do. So patients, if they have some disc bulge, which we call disc collapse, so this can be treated with epidural steroid injections. The different model types are there, where we give transforaminal epidural steroid injection, particularly to that nerve root. So once there is pain-free, patients can go for rehabilitation programs and physiotherapy, so that the effect lasts longer. So, and sometimes the patients will have SI joint inflammation, and we can do SI joint injections. We do procedures inside the OT under guidance, ultrasound, or under CM, that is X-ray guided. So these are some landmark guided procedures we do inside the OT, depending on the patient's condition. Like chronic back pain, we generally give epidural steroid injection, SI joint injections, medial nerve block, and then piriformis injection, where because nerve gets entrapped inside the muscle, and then it will be causing pain. So this is one of the common causes for back pain. And this is one of the newer modalities of treatment, radiofrequency ablation, where we particularly ablate the nerve causing the pain. So sometimes there will be coccydia pain because of post-trauma. And for this also, we treat with ganglion implant block. This is all done under X-ray guidance. So some people, one of the common causes of pain is osteoarthritis knee. We can do genicular nerve block for knee pain. Okay. So lumbar sympathectomy and neuromodulation are some of the other treatments modalities for chronic pain. Spinal cord stimulation is also one of the interventions done. So there are some advanced medications which are in the pipeline for treating chronic pain. And one of the important behavioral therapies, it has been found to be very effective in for treating chronic pain. Virtual reality is also have been found to be very effective in treatment of chronic pain. And some newer interventions have been found, like deep brain stimulation and transcranial magnetic stimulation. These are newer modalities which are under discovery for treatment of chronic pain. So it is very difficult situation where we need to address the situation, socio-cultural aspects of the elderly patients during chronic pain, because most of the times they'll be having little associated depression or symptoms also, because they'll be isolated, they'll be less independent because of the chronic pain. So their mobility will be impaired, and we have to address all these situations along with the medications and therapies. So we should encourage the family and caregivers to encourage mobility, help with medications, because they'll not be in a position to take medications on their own, and monitor their mood and sleep, and often offer some emotional support along with socio-cultural support. So final takeaway is chronic pain is not a natural part of aging. It can be managed with holistic approach, and early intervention approach improves the quality of their care. Once we do some interventions and take away their pain, they'll be more mobile. They can go around, and yeah, along with this, some physiotherapy, yoga, meditation, acupuncture, they'll be more like independent on themselves, and this also helps in overcoming their depression and anxiety symptoms. Thank you.
Thank you, Doctor. Thank you. The Dr. Mahesh Himadri, who is actually a geriatrician from Dehradun. He is online. He has raised one question, Doctor. This is Dr. Mahesh from Rajasthan. Then
Okay.
those patients who don't respond to conventional treatment for post-hepatic neuralgia, what kind of blocks do you give? How long it affects last? Suppose, Dr. Mahesh, would you like to unmute yourself and ask the question?
Yes, sir. Very good afternoon, sir.
Yeah, please go ahead. Please
Good evening.
Go
ahead. Sir, can you listen to me?
Yes, sir. Yes, sir.
Sure.
Like elderly patient usually respond to conventional treatment for post-herpetic neuralgia, but suppose if they don't respond, and
Yes,
due
sir.
to side effects, we have to withdraw all the medications like carbamazepine, gabapentin, pregabalin, nortriptyline, whatever medicines it is given, tramadol. So in such cases, usually we refer to pain specialists like people like you, like who give blocks to such people, na?
Yes, sir.
So like if you consider patient for block treatment to be given in a block, suppose if you give blocks in that patient, like how long the effect will last? Whether patient has to come repeatedly.
We can give, according to my experience, like we can give intercostal nerve block, paravertebral block for thoracic herpetic neuralgia patients. And sometimes what I have experienced is we just infiltrate this patient along the lesion, some local anesthetic with steroid. They have very good relief. Even with one sitting only, they have good relief. Sir.
Like how long it lasts, sir?
Because the ones which I have done treatment, they haven't come back to me after the injection.
That's great. So did you use the lidocaine patch?
Lidocaine patch is also effective, but more like once we do some infiltration, local anesthetic, a lot of normal saline and some steroid. If we inject along with lesion, so infiltrate, just local infiltration also, they have good very good reliefs.
Okay. But how do you do that with the lidocaine? You infiltrate or steroid?
Lidocaine and steroid both along with some saline.
Okay, thank you.
Because that's what I have found, like they have long lasting relief, because they'll be sometimes they can't even wear their dresses and all, because there's so much of hyperesthesia and will be there. Even
because
we can't touch their skin.
It's very common in elderly, 1 in 1,000 it is seen. And in diabetic patients, it is more common.
Yes, sir, true. So in those cases, we can use lesser amount of steroid if the diabetes and sugars is not very controlled. And then we can again do repeated injection if it recurs.
Okay, thank you, sir. Thank you.
Thank you.
Thank you, doctor. That helps. So, doctor, I mean, one more thing that we are coming, number of people we are coming across is that non-diabetic neuropathy.
Yes, sir.
As a non-diabetic neuropathy, I think, do you have any kind of treatment for that?
Sir, most of them, these will be like B12 deficiency will be there. We have to supplement them with B12. That is one of the common. B12, B complex.
Doctor, B12 is found to be normal. See, in fact, there is a specialized clinic in NIMHANS for this.
Okay.
And I have met some number of people with the non-diabetic neuropathy problem, but they are finding it very difficult to get some kind of a cure.
Okay.
I mean, probably
usually gabapentinoids help to a certain extent.
Yeah,
but sometimes even for that they'll be refractory.
Yeah, see, that's people are finding it difficult, but because you have been talking about some kind of a therapy, whether do you have any therapy for this also? That I was just wondering.
Yes, sir. Like we can give some local anesthetic steroid for the that particular region
Uh,
infiltration, and then we can see if it has helped.
if
Helpful.
it helps. Okay, okay.
Yeah.
Thank you. That helps. That helps.
Most of the times, these therapies they are diagnostic also and therapeutic also. Whatever we do the injections, only if they have some good relief, we can say that it is diagnostic and it is arising because of particular nerve. And then if it is effective, then we can do the regular therapy.
Okay, okay, doctor. Thank you, thank you. And you also advocate, yoga and naturopathy or some kind of a
Yes,
treatment.
sir. Yes, sir.
Yeah.
Definitely, sir.
Do you
They
also,
all
yeah, do you also train on the people train on that, or you have some other persons to do that?
actually have got myself trained. I am a 200-hour yoga teacher training also done. But
Okay.
any specialized person along with that would be very great.
Oh, that would be excellent. So you are yourself a trained yoga means that you know everything about it. That's great. That's great. Any other person would like to ask any other question? It was an excellent session, doctor. That is your.
Manjunath sir has raised a concern.
Ah,
Yes, Manjunath
Yeah.
sir.
Namaste, sir.
Doctor,
Yes, sir.
I am Manjunath.
Yes.
I am a tennis player. A year back, while playing tennis, I got a nerve pull in my left leg. I became immobile. Then
Oh, okay.
gradually I went home. Then I could not bend from my knee, left knee. So I went to sports orthopedic in Baptist Hospital. They
Okay.
examined and they checked the X-ray and all that. They said that there is no permanent damage. They gave some painkillers. Uh, so gradually I got relief. Then the knee pain was gone, but uh, left between foot and ankle, I used to get severe pain. I was not able to walk properly. That lasted for so many months. Uh, then gradually it was getting better. So I was avoiding any surgical treatment which was advised. And some doctor advised some epidural steroidal injection. So even that I was postponing because it was becoming slightly better. But all of a sudden, there was no change in any of my condition. I did not exert any of my uh, leg. But I got severe pain one day. Then I went for epidural steroidal injection. The 3 injections at an interval of 8 hours each. So while getting injected, that time itself, I got a severe relief, as if some blockage in the pipe is removed. Like that, I got so much relief. Now I am painless. But my question is, how long does this last, or is it time limited, or what is it?
Sir, based on your symptoms and really explanation, I think most likely it is because of some disc prolapse. Is it true?
Yeah.
On MRI, there was a disc prolapse.
It was diagnosed as spinal stenosis.
Yes, sir. So generally, this condition it has some if it is not very tight stenosis, and then the epidural steroid does help. But each patient is response is will be different. Some patient will have some relief for 1 week. Some patients will have some 3 weeks. Some patients will have some for 3 months, and some patients will have some more than a year and all. So each patient response is different. But if you, along with the epidural steroid, if you undergo physiotherapy treatment after once you have the pain relief,
They advised me back strengthening exercise. Every day I'm doing it.
yes,
I got injected on January 15th of this year.
yes.
So from then on, for a few days there was slight pain, but now I am painless.
That's what, sir. Like if you undergo regular physiotherapy and all, your pain, this one will be lasting longer of the epidural steroid. Otherwise, what happens? You again go back to your regular routine. What happens is there will be weakness of the muscles and your pain
Okay.
recurs.
Okay. I'm doing that back strengthening exercise without fail every day.
Yes.
My another question is whether can I go back to playing tennis as a intermediary? I'm playing shuttlecock. There is no pain.
So for your age, you are doing very good. You are very active. I feel you can go back to your pain if there is the pain relief is there.
Okay.
Just be careful, like when you're stretching, and you should not over stress yourself and you get injured again. That's all. You should be
Yeah.
careful about that. But
Yeah.
if your pain relief is limited, you can and being active and mobile is advisable. So,
Okay.
definitely.
Thank you.
But
In case
over is that,
doctor,
and
yeah. No, in case pain recurs, what is the next relief that we can think of?
sir, one is medication. First, start with medications. If it doesn't come down, then you can try with interventions like steroid. But sometimes
Okay.
if it's not coming down with interventions also, then is the surgical approach.
Okay. Is there possibility of taking epidural injection again?
Yes, sir. Yes, sir. Like if it is if it is not causing much of compression symptoms, which is not like sudden weakness in the legs or any bowel bladder is not involved or something like that is not, they are all indications for immediate surgical interventions. If something
Okay.
that is not there, then
Hmm.
always we first go for medications,
Okay.
then go for first is stretching physiotherapy exercises, then go for
Okay.
medication, then go
Okay.
for interventions, and then
Hmm.
surgical. It should
Okay.
always be step by step approach. That's what I feel.
Hmm.
If you go to a surgeon, they will first probably see there is a discharge. We need to operate. That would be the approach. But
Yeah,
from
that's what many doctors
intervention,
advise me. Hmm.
as an interventional pain physician, my approach is always non-interventional. First is
Okay.
your physiotherapy,
Yeah.
strengthening exercises, medications,
Hmm.
interventions,
Yeah.
then surgical,
Hmm.
step by step.
No, but the injection I was asking because they are steroidal, no? They are not advised to be taken often.
Depends.
That's why.
Like if you are also diabetic and all, it is not advisable to go for frequent steroid injection. That is why I tell first is
Hmm.
medications.
Hmm.
Then only if it is not subsiding and it is still interfering with your daily activities, then we can go for interventions like
Hmm.
steroid injection. Yes.
Thank you.
No,
Thank you.
because once I have already taken steroidal, is it advised to take it again after some time?
Yes, sir. Like if a pain is recurring, it is interfering with your daily routine activity, and if
Yeah.
your sugars are within control,
No, I'm
then only
normal. I have no diabetic.
every procedure, any intervention will have their own side effects. Profile will be there.
Hmm.
So, but this is relatively safe.
Thank you,
Oh.
sir. So, Mr.
Thank
Ganesh,
you. Thank you.
so Mr. Ganesh has raised his hands.
Yes,
So,
sir.
Ganesh, sir, you can go ahead, sir.
Yeah. Sir,
Sure.
this nerve ablation they are talking, will it
Yes,
have a
sir.
side effect? Like, for example, a knee pain, you are
Yes, sir.
ablating the nerve, and then will it not further deform the joints and things like that, sir? I have a doubt. I don't have any problem, but it's a general doubt. Nerve ablation,
This
do you have any other?
intervention is advised only for grade 1 and grade 2 osteoarthritis knee, where it is in the
Okay,
initial stage.
okay,
And thing is like we don't actually there will not be much side effect because we are only sensory supply of the joint. We are by ablating this nerve. That's only the sensory part is taken off. So you'll have some pain relief, and you can undergo so that you can undergo the physiotherapy and all without any pain.
okay,
That is the main funda.
okay.
And grade 3 and grade 4 arthritis, they usually advise knee replacement. But
Oh,
even if the patient is not fit for surgery, like if they are don't want surgery, then they can opt for this radiofrequency ablation.
okay. Thank
And
you.
the pain lasting for 6 months to 1 year, like that,
1 year.
and they recur again.
Oh, it will pick up again. Okay.
Yeah.
Thank you. Thank you.
Thank you,
Doctor,
Dr. Yeah, please. Who is that?
Dr. Lohith sir, do you know any acupuncture training centers in Karnataka wherein they have laser equipment and advanced technology where they can train doctors for acupuncture?
Sure, like there is one center just opposite our Rajiv Gandhi University. So like I have been there a lot of times myself and I've learned some basic acupuncture there. They do treat a lot of patients there. And they do have some courses for doctors.
I see.
Bharat Sevak Samaj, that this one under that banner they do train.
That's great, doctor. That's, I think you are happy with the information, sir? I don't. Doctor, if you are not using this, I mean, this thing, you can remove the screen sharing, doctor. If you are not using
My
screen share, yeah,
okay, fine.
screen sharing, you can remove the screens.
Okay.
Doctor, you have been talking about some virtual treatment. What exactly is that, doctor?
That is one of the newer modalities where they give the virtual reality headset for
Ah.
the patients to get them diversion. Basically, it is more of diversion.
That is, I mean, can you just give me a little more, doctor, on that? Because we are often hearing that word, virtual treatment.
Yes, sir. Like we can see there is a headset with it is coming onto the screen, just like a screen, movie screen. So patients will having some they do are doing some therapies or some engaging activities